Hey everybody, I'm Maggie and we're back on SRH Access Facebook Live. Today we're here in our inpatient unit and we're here with our nurse Katy.
Hi!
We're so excited to be here because we're actually going to be on the move, walking around the inpatient unit to learn about the different steps that our patients go through after they have surgery. So Katy, can you give us a kind of an insight on what your daily responsibilities are?
So as a nurse, we're here for 12 hours and we kind of just take care of our patients for the full day, and it ranges from coming in for surgery, which a lot of our kids come in for, or they're here more long-term, waiting to get surgery. So we just kind of go based on doctor's orders, see what our patient needs for the day, but we'll come in usually around 7:38, wake up our patient, get the day going, and then just kind of go from there. And then this is one of our typical rooms that we'll have a patient in.
Cool. And I know, this is really good for parents and for any patients who are about to have surgery, really an education to kind of show them what the room is and maybe what to expect. So can we kind of go through what are some of the amenities in this room that a family member and the patient can expect when they come here?
Yep. So I know it can be a little intimidating when you're coming in the hospital for the first time, don't really know what to expect, but you'll be in a room kind of like this. They're all a little bit different, a little kind of the same also, but this will be your patient bed. And then on the sides here, you can control the head of the bed, go up and down, bed go up and down, get more comfortable for the patient. One family member can stay the night, and they'll be staying in this chair. It goes all the way flat. It's kind of a bed. We like to make it as cozy and comfortable as possible, but that's what we've got as far as sleeping arrangements. We've got a TV that everyone's free to use. We've got a telephone that'll connect with dietary so that our patients' meals can be ordered. And we provide a menu and all of that for our patients. And we just go based on doctor's orders as far as what they can eat, when they can advance if they just had surgery, as far as going from nothing to eat to regular food. They've got their own bathroom in here.
Which I think we're going to get a little tour.
Yes, we'll get a little tour of that, so you just wait for that bathroom.
Yeah. So you were talking about how one family member can stay overnight.
Right.
So in terms of like visiting hours during the day, what does that kind of look like and what can we expect?
Usually our visiting hours are about 8 to 8. We don't have a strict policy on like how many people can come visit at a time, as long as no one's causing a big ruckus.
Yeah.
But definitely one person stays overnight. It just makes it easier for the patient to kind of relax and easier for the nurses and all of the staff to come in and do their thing.
Okay.
So.
And then you were mentioning about dietary and how they can call depending on what the doctor orders. So what does that kind of mean for the parents? Like, are parents able to use the cafeteria downstairs? Is that available to them?
Yes. So only our patients can order from the room, but parents are definitely free to use the cafeteria. They've got different hours. They're open for breakfast, lunch, and dinner. They do close early. I like to tell everyone that. They close around 6 o'clock for dinner. So you need to get some early dinner. But other than that, parents are free to get what they want from the cafeteria.
In terms of dietary needs for the patients, I mean, it's beforehand their doctors and nurses are aware of what they can and cannot eat in terms of even past, allergies they may have or stuff like that.
So when they get admitted, we'll go through a whole admission process. As the nurse, our part is to go through your health history, your medications, your allergies, kind of what you like to eat, all that good stuff. So we go based on that. And usually they can eat whatever they want the night before surgery, and usually about midnight is when we cut them off and they can't have anything to eat or drink. Everyone's a little bit different, but that's kind of the usual. And then after surgery, they've gotten a lot of anesthesia, a lot of medication. So we kind of like to slowly advance them. So we'll start with some ice usually first after surgery, make sure they're a little awake, their stomach can handle it. And then we kind of progress our way up, going to water, juice, crackers, and then regular food.
Okay. And on average, how long are patients staying in inpatient? I mean, I know it's different for everybody, depending on the surgery and the case, but...
So it does vary, because we'll have patients that will come in for a same-day surgery, so they'll come in, get admitted to our room, get back, get recovered in our room, and then once their pain's controlled, they can tolerate food, then they can go home. Other patients stay another day or two. Every now and then we'll have some kids that stay a month or so just because they're waiting to get their surgery, their next surgery. So it varies, but usually it's a couple days.
Okay. And then how many inpatient rooms do we have?
So we have about 33 rooms on our floor, and about 52 beds. So some of those rooms have double beds. So when we're really, really busy, maybe in the summer, we might have to double up our rooms, but generally everyone gets their own room.
Okay, cool. I think we're going to look at this board. I know that you guys use this
Sure.
a lot, and we can kind of walk through maybe who can they expect to come see them in the room and that kind of thing.
Perfect, yes. So you'll see a lot of different people when you come in. Your nurse, your doctor, your patient care tech are the ones that you're going to see most frequently. And every morning, usually we'll come in and write who your nurse is going to be, write your name down, who's the charge nurse for the day. In case you're having any problems and you need to talk to anybody else, you can always contact our charge nurse. Respiratory's on there in case sometimes they need breathing treatments before or after, so they'll be on there also. Child life is a big one. We like to be involved with everyone. They just kind of help make the kids more relaxed.
And I think we're going to talk
we'll talk about that,
a little bit later.
but they'll write their name. And then the patient care tech comes every couple hours, get your vital signs, make sure you're doing okay, helps you to the bathroom, gets all that kind of stuff. And then anyone else that comes and sees them. A lot of times, since we have a lot of surgeries, they'll need to see physical therapy or occupational therapy, just depending on what kind of surgery.
And then what is this comfort level?
Yeah, so this we use all of the time. So since we had surgery, you're probably going to have some pain. So we use this scale to judge like what kind of medicine we need. So 0 is wonderful. We're not having any pain. Usually after surgery, we're kind of in a 1 and a 2. When we're getting 3 and 5, that's real bad. We want to give you some good medicine. So we'll ask you all the time, what is your pain number 0 to 5? And kind of medicate you based on that.
Cool. Well, I think we're going to take a look at the
Perfect.
bathroom, and then we're going to take our journey down the hallway.
Okay. Okay, so this is a really cute bathroom. You get your own bathroom in your room.
We have the lights on in here.
You've got a shower in here. We'll get you towels, soap, anything you might need.
So are patients normally showering right after surgery?
It usually it's a few days after surgery.
Okay.
So you can expect some sponge baths at home or here.
Okay.
Just for usually the first few days, just depending on where your dressing or your cast is at. Mm-hmm.
Cool. All right. Well, let's take the walk.
Cool.
I know it's nice because it's so colorful and
Yeah, we like to
happy
make it as fun as we can for the
down
kids.
these hallways. So I know we're coming up on this. Is this a nursing?
Yes, so this is
station?
the back part of the nursing
Okay.
station. Our whole unit is a big kind of oval.
Okay.
So you can see everyone on your way around.
Okay.
But we'll have nurses that sit back here. They're close to the rooms in the back.
Okay.
So usually if your patients are back here, you kind of want to sit back here.
So if you ever have, if a patient maybe needs something from a nurse, can they press a button?
Yes, there's a button in the room. It's
Okay.
a red button on the remote for the TV. You push that, it goes to your nurse's phone.
Okay.
And they can get you whatever
So
you
all
need.
our nurses kind of have mobile.
Yes, we've got mobile phones,
Okay.
so if you need anything, you call us, or if we couldn't answer at that time, we'll have somebody else
Okay.
grab the call light
Got it.
and get you what you need.
Awesome.
Yeah.
Okay, so we're coming up on 306, which I know is another place that
Yes.
our patients kind of go to. So can you kind of give us a rundown on what happens here after surgery for patients?
So this is 306. This is what we call our spine unit. Do we go in there? So a lot of our spinal fusions will come back here. It's just a little bit, it's set up more of like an ICU, but not an ICU. It's just so we can more closely monitor our patients.
And what's is there an average time that maybe they're back there before they get put into their
Sometimes
room?
they'll be back there for their whole stay, the whole surgery. But a lot of the times they'll come out the day after or 2 days after,
Okay.
and they'll come out to one of our regular floors.
And how
out
many
here.
rooms are there?
There's 5 rooms back
Okay.
here, and usually 2 to 3 nurses will work back here, and it's just you get closer access to your patients,
Right.
and they'll be on monitors, and they're just
Yeah.
easier to see.
To keep them safe.
Yeah.
Okay. All right, next up, I think, is the schoolroom, which is
Perfect.
kind of a cool thing that we have for some of our...
This is a very cool thing.
Yeah.
I haven't seen this at other hospitals I've worked at, so I love
Yeah.
this part of what we do here.
So what goes on here, and is there how long do patients have to be here for this amenity to be something that they can
So
use?
usually our long-term patients that are here maybe 2 weeks or so, or they're staying a couple months before they get their big spine surgery or something, they can be enrolled in Dallas ISD, and they'll come into the schoolroom, and we do all developmental ages, kindergarten through 12th grade. We've got one teacher that teaches that's specialized in all of the developmental ages. And
That's
then
great.
she just kind of does the work with them.
Okay.
And they do about 4 hours a day for school, 2 hours in the morning, and then 2 hours in the afternoon, and they'll have their other therapies in between.
Is there a set time in the morning and the evening, or is it just kind of whenever they're available? or
Usually
can do
it is from 8:30 in the morning, so we kind of like to wake our kids up a little early, get them ready to go. 8:30 to 11, and then I want to say 1 to 2:30
Okay.
to 3 in the afternoon. And it's the same time every day, Monday
Okay.
through Friday, and they follow the Dallas ISD schedule, so if it's a holiday, they'll be off
Right.
school.
Okay.
So, yeah.
So then, I mean, it's probably a big transition with parents and everything to
Right.
come through and transition from like their normal school to this. So
Right.
that's something that we can
Yeah.
help them with.
Right,
Too, as
yeah.
well. Okay.
So, yeah, usually it's an easy transition. They just unenroll in their school that they're currently at, enroll in our school, and then once they're discharged, they just unenroll here and re-enroll in their school, and we've got an inpatient unit coordinator that kind of sets all of that up.
Okay.
So,
And so when they get, I mean, is that something they're setting up before?
yeah, so
well before their
usually
surgery?
we'll know
Okay.
if a patient's going to stay here for a while, so they'll kind of get the paperwork and everything
Got
going. If it's more of an unexpected stay, then that's when our inpatient unit coordinator will come in and bring the paperwork, kind of get that ball rolling.
Great.
So,
Awesome. Well, that's really cool.
yeah.
So we're going to keep going around the corner, which will be at the front of the inpatient unit. So I think now it's all about the activities, the fun stuff.
Yes,
that
we
some
have a
the
lot of fun
patients
stuff here,
that can
so-
do. And I know when we come through here, we can talk a little bit about this waiting area
Uh-huh.
for families. And is this, I mean, once we get there, is this kind of where parents are kind of waiting until the patients get out of surgery, or what really is this?
So really,
area
you
for?
can kind of wait anywhere. We've got multiple different waiting rooms that you can
Okay.
be at, depending on how many people you're going to be with. But we've got this area that's on our floor that you can wait at. You can wait in the patient's room
Okay.
until they're about to come back. And then we've also got a waiting area on the 4th floor, or you can wait in the cafeteria if it's open.
Okay.
Pretty much anywhere as long as you're in the building.
Right.
Uh-huh. And then you'll be given a little, kind of a restaurant little vibrator thing. So whenever our patients have an update when they're in surgery, they'll call or
okay.
they'll buzz that, and so the parents will know
Awesome.
when it's time to go get an update downstairs.
Great.
Yeah.
Cool. Okay. Well, let's keep going. I think we're going to go to our bridge area. It's very sunny
Perfect.
and warm
It's a
over
great day.
here. Yeah. So I think we can kind of get a taste of, like you said, some of the activities that
Right, yes.
that they get, and yeah. So we can just talk about what's going on across the way.
Okay, perfect. So on the same floor, you cross this bridge, and you're going to get to all of our therapies. We've got physical therapy, occupational therapy, just to kind of get you up, moving, and grooving after your surgery. Child life is also down here. This is the
Yes.
most exciting one.
Right.
So child life is super involved in our patients' care. They provide all of the fun activities, the games, the movies, any kind of activity that'll fill the patient's
awesome.
time while they're here. Especially if they're here for a long time, it can get kind of boring. So we just kind of try to give them whatever we can to make
Right.
their stay more fun.
So child life, is that a daily thing for them?
Yeah, so it's
Couple
open
hours?
Monday through Friday. It'll be open in the morning and in the afternoon. Wednesdays are a little different, so they won't have a morning session of child life, but we have pet therapy instead.
Okay.
So we'll have some cute little dogs come around
Yeah.
and visit all the patients. Just a little fun activity that we do every week, and then in the afternoon it'll be open again. And the patients are free to come down here with their families, their parents. They have little arts and crafts, games set up, all kinds of different things that they can do. If the patient's unable to come down here,
Yeah.
we bring the fun to them.
Okay.
So we can set up a big movie screen, get some movies going. We've got some Wii's that we can play games on, that kind of thing.
So is there a certain amount of time for a patient can kind of get up out of the room to go to child life, or is that something that obviously probably
Right.
depends on the patient?
It depends on the patient, but kind of as soon as they're able to get up out of bed. We like to get them up and going as soon as we can.
Okay.
We don't want them to lay in bed for too long because you get better the more you're out of bed.
Right.
So if we provide fun activities, that gives them some incentive
Yeah.
to come to. Kind of as soon as we can get them up and moving, maybe get them in a wheelchair to come down here, just to get them out of the room.
Yeah,
so
that's cool.
Even next day after surgery, we can come down here.
So I know you've worked nights before.
Yes.
So for these kids, what can you tell them about, the evening? I mean, activities
Right.
for them at night.
Yes.
Because obviously they maybe want some exciting things to go on in the hospital.
So at night, not a whole lot of fun, bedtime. Nobody
Right.
wants to go to bed. Where's the fun?
Right.
Around 7 o'clock, we have a bunch of volunteers that come in and take the kids that are able to activities up on the 4th floor. They have all kinds of different games. We'll play some basketball or air hockey, all kinds of different things up there. And they do that for about an hour, get out all their energy before bed, and then they come back up here for bedtime. And we can rent out movies too, so they can watch movies at night if they want to. But Child Life isn't open, but we can supply them with some fun things to do at least overnight. So
Awesome. I know later in the year we're going to be going to Child Life to do another Facebook Live, so we'll be able to get even more of the fun that way. But I think that kind of wraps up our tour. So thank you so much for joining us for this little ride this morning.
Of course.
And we appreciate just learning more about the inpatient unit. So thank you. All right, well, we'll see you next week. Take care.